We feel that a life-changing gift deserves life-changing care. That was one of the reasons that the Center for Living Donation was created in 2017.
The old paradigm was the recipient is the sick patient. They require most of the attention. And we realized that living donors were not getting their appropriate amount of attention, medically, research-wise, psychological, preoperatively, and postoperatively. So we decided to begin the Center for Living Donation, which focuses on the care of the donor.
And we want this to be a win-win situation where we take a healthy person, take an organ, give it to somebody who really, really needs it. Both of them recover and they're on their way. But part of our role is protecting the donor, making sure that they understand what they're getting into, making sure that there isn't any coercion or pressure, making sure they have realistic expectations, and making sure that the donor and the recipient have the support that they need, the help that they need to be able to recover and to do well.
Every donor has an independent living donor advocate. There is the surgeon and myself. There's a medical professional, either it is the hepatologist or the nephrologist, social work, transplant psychology. There's the donor nurse coordinators, our medical assistants. And then there's also the team on the inpatient service, the surgeons that see the patient inpatient, the residents, the fellows, and the advanced practice providers that take care of the patients while they're in the hospital.
They're going to make sure that everything goes right, everything runs smooth, and you have your own team. You have a team and the recipient has a team. So you're their number one.
The first time that I became acquainted with the Henry Ford Transplant Institute was after reaching out to my recipient. It was made clear to me that it was very important to Henry Ford to ensure that my team had my interests in mind, and that if there was anything that would make it unsafe for me to be a donor, that they would uncover that and make sure that the procedure only went forward if it was in not only my recipient's best interest, but also mine as well.
We feel that the living donor and living donors in general are a special group of people. I always say our living donors are angels on earth. They are deserving of a very different frame of thinking, types of services we provide, things we can prepare them with, and after they go through the experience, to make it the best experience for them. And then when they have gone through that, they say, you know what? I don't feel bad a single bit. As a matter of fact, I feel special. I feel augmented as a person.
We also do what's called kidney paired donation, what patients know as the swap. If you come in with your brother who would love to donate to you but cannot, we will allow him to donate to someone else and have that other person donate to you. And we've done swaps as large as 10 or 15 people.
And the big goal here is encouraging patients to be universal donors. So we've had several compatible donor-recipient pairs come forward wanting to do greater good, be a part of a bigger story, and help several incompatible patients. And we've had kidney pairs and kidney chains which have gone on and on and on within the Institute. So one compatible pair has helped several incompatible people down the line.
So when you, as a donor, help a recipient who's on the wait list, that recipient comes off the wait list. So hopefully the next organ that becomes available, there's less people in which you have to choose from. So it opens that venue for some other patient.
I would say that the program is very innovative and always has been. It's a jewel of Detroit. We've always had good quality numbers in innovations from robotics to split liver to living liver donation. Good volumes and good outcomes. And those who know. But just like anything else, you have to be adjacent to the information.
This was an amazing journey. I would do it again and again. Very few people can say, I saved someone's life in that way. And every day I think about it, how amazing it was.
I often tell my donors that it will change their life and their family's life in a way that they can't even imagine until after they donate. They really restore my faith in humanity.
My favorite quote is, "To know that one person has breathed more easily because you have lived, that is to have succeeded." And I think this was a way for me to live into that. I don't regret it at all.